Hello, my name is Desiree Stringer, and this is my specimens checkoff. When you first start this checkoff, you want to knock on the patient's door, and when you enter, you want to close that door behind you, just so it'll give that patient some privacy. When you walk in, you want to be like, introduce yourself, be like, hey, my name is Desiree Stringer, and I'm going to be your student nurse today. What is your name and what is your birth date? They're going to give you that information, and you're going to make sure that is the correct information as it is on the wristband. Once you get the indicators matched up, you want to go and check your charts to make sure that you're doing the right things for today. Then you're going to wash your hands, and then you're going to explain to the patient what you're going to be doing today. Make sure they are comfortable, they don't have any questions or anything like that. You're also going to use very, very, very safe precaution measures with this checkoff because you're dealing with blood and bodily fluids. You would use these precautions with anything you do, but with this one, you're dealing with a lot of liquids that are coming from the body. So you just want to treat everybody any patients, as if they have HIV. So the first one that I'm going to talk about is the clean catch urine test, and that is when you start a stream of urination and then you cut it off and then you urinate the rest of the stream into a cup, and this is a very clean method of catching that urine because it goes straight to the cup. And then you're going to want to do the 24-hour urine test. This is when you do urine testing for 24 hours. Every time a patient urinates, you're going to want to catch that urine. If the patient ends up urinating into the toilet and flushing it, or if something goes wrong with this process, you're going to have to restart and do a different 24 hours. Then you're going to want to do your hemocult test. This is testing for occult blood in the stool. So you'll check that and make sure that there's no blood in that stool. Then you're going to do your blood glucose test. You're going to want to prick the finger and draw blood from a patient. You're going to wipe off that first drop of blood, and then you're going to wipe that second drop of blood onto the testing strip. Then you're going to do your throat culture, and that is when you get a sterile cotton swab, and you're going to want to put it in the back of your throat, kind of like a strep test. You don't want to touch anything, only that infected area. And then you want to do your sputum culture. With your sputum culture, you're going to want the patient to take a lot of deep breaths, and then you're going to want to wash their mouth with clean water, and then you're going to want to get a container and let them cough up into that container just to make sure you get all that sputum in there. Then you're going to want to do the wound culture, and with the wound culture, you're going to want to swab the wound and make sure you put enough pressure on that wound to get the fluids onto that swab to put it on the test. And this allows you to see like what kind of infection or anything that this wound might contain and all of that. And then when you do your physical exam on a patient, you're going to want to inspect every part of the body, make sure that the color is normal. You want to make sure that there's no lumps or bumps, no big wounds or anything like that. You're going to want to use percussion and also palpation. You want to touch and feel and make sure that everything's normal. You also want to use osculation. You want to listen to the sounds of the body parts. You want to listen to like the lungs, make sure there's no wheezing or any other kind of sounds coming out of those lungs. You want to listen to the heart, make sure that that heart rhythm's going good. Listen to the stomach, just anything that sounds normal is okay. And then anything that doesn't sound normal, you're going to want to chart it. And then you're also going to use manipulation on them. And just to make sure when you're doing these physical exams, you're going to want to cover the body unless it is the part that you're working on. This gives those patients the privacy and let them contain the dignity of themselves. And then when you're done, you're going to make sure that the call light is in reach. You're going to make sure that the bed rails are up, that they're comfortable. Make sure they don't have any questions about what you did or anything like that. Make sure they're in no pain. And then you're going to want to dispose of your gloves, and you would want to put gloves on before you did all of this. And then you're going to want to wash your hands after disposing of your gloves. And then you want to chart everything you did into your charts and anything that was normal and abnormal that you've seen in that patient.